The Comfort Recline Sling is used for transfer from bed, chair, or floor, and to boost and reposition. The same sling application and transfer procedure is used whether lifting with a ceiling or floor lift. As with all medical devices, use sound clinical judgment and always use lifting devices only for their intended purpose. Comfort Recline Slings come only in comfortable, breathable, spacer skincare fabric. Features of the Comfort Recline Sling include the body of the sling with the smooth side opposite the label placed towards the patient's body, shoulder and leg loops for attaching the sling to a carry bar, and within those loops are destination loops used for positioning the patient and adjusting the amount of recline. A storage pouch containing inner thigh loops can be used to provide added security. Use of this feature is optional. The sling label lists the type or style of sling, the size, the reference or product identification number, and the maximum allowable weight or safe working load. Remember to always stay within the lowest safe working load of any component in your lift system. The label also includes washing instructions, which are detailed later in this video. Packaged with each sling is a user instruction sheet. Use the color-coded sling sizing chart to choose the right size sling for your patient. Remember that the patient's weight is just the first consideration when choosing a sling size. People come in many shapes and sizes, and it is completely acceptable to choose a size sling other than that indicated by weight alone, as long as you stay within the safe working load and the patient fits safely, securely, and comfortably in the sling. Visually inspect every sling before use. Discard and replace the sling if any signs of damage or wear and tear are found. To place a Comfort Recline Sling under a patient in a supine position, first fold the sling in half with the label on the outside. Next, roll the patient to their side. Adjust the sling position so that the fold is about a hand width from the back of the patient, and the darts in the sling line up to the patient's tailbone. Roll the top fabric of the sling over on itself, tucking the loops in the fabric, and roll the fabric to the patient. Tuck the roll of fabric under the patient and roll the patient to their other side. Then, unfold the sling and roll the patient onto their back and onto the center of the sling. Pass the sling leg loops through the inner thigh loops located in the storage pouch. Next, raise the head of the bed about 45 degrees. Bring the carry bar into position crosswise along the patient, keeping a hand on the carry bar for safety. Attach the leg loops to the lower carry bar hooks and the shoulder loops to the upper carry bar hooks. Whenever attaching loops to a carry bar, make sure to match the hooks and destination loops on the left and right sides so the patient is raised as straight and level as possible. Raise the patient just enough to put slight tension on all the sling loops, make sure they're well secured on the carry bar hooks, that the sling is well positioned under the patient, and that the patient feels safe and comfortable. If any adjustment is needed, lower the patient and adjust as necessary. All Comfort Recline slings have multiple destination loops. You can adjust the amount of recline by connecting different destination loops to the carry bar. Attach the sling loops to the carry bar in a way that best suits the patient's condition, positioning needs, safety, and destination. To transfer the patient to a fully upright seated position, attach the long leg loops and the short shoulder loops. For the most reclined position, attach the short leg loops and the long shoulder loops. Once securely positioned in the sling, lift the patient only as high as necessary to transfer them. Transfer the patient to their destination and safely lower. Removing the sling is the reverse of placing a sling under a patient. For patients with skin integrity concerns, the Comfort Recline Sling comes in comfortable, breathable, stretchable spacer skincare fabric, which is compatible with airflow mattresses and distributes pressure more evenly than other fabrics and helps prevent pressure sores and skin tears. When appropriate, this sling does not need to be removed and can stay under the patient. Washable fabric slings should be placed in a mesh laundry bag before laundering to avoid tangling, wear, and damage by washing machines and agitators. Wash in a mild laundry detergent and never use any kind of chlorine bleach. Fabric and loops exposed to chlorine will show a color change and should be discarded. To disinfect, wash at 176 degrees Fahrenheit or 80 degrees Celsius. Tumble dry low or hang to air dry away from direct sunlight. For more information, please call us at 1-877-304-5438 or visit our website, prismmedical.ca.